All right, let's dive into a topic that's, surrounded by a ton of anxiety and just plain misinformation, the clinical condition known as micropenis. In this explainer, we're going to cut through all that noise, separate the medical facts from the cultural fears, and really get to the truth of the matter.
You'd be surprised how often this question comes up. Behind the closed doors of a doctor's office, it is one of the most common and quietly asked questions. It's a source of some serious worry for a lot of men, so it's really important to understand what's actually going on behind that concern. So first things first, we have to draw a really clear line in the sand between two totally different things. On one hand, you've got what's often called small penis syndrome. Now, this isn't a physical condition at all. It's a type of body dysmorphia. Basically, intense anxiety about size, even when someone's measurements are perfectly average, and it's often fueled by cultural pressures. Then, on the other hand, you have micropenis, which is a rare, actually diagnosable medical condition. Getting this distinction is absolutely key, because it separates a psychological worry from a clinical reality.
Okay, so let's set aside the anxiety for a minute and get right into the hard clinical facts. What does the term micropenis actually mean from a medical standpoint?
The very first thing to wrap your head around is just how incredibly rare this is. We're talking about only 0.6% of males worldwide. Let me be clear, this isn't just someone being on the smaller end of the average range. We're talking about a genuinely uncommon medical condition.
And to put an even finer point on it, if we look at data from the United States, it affects about 1.5 out of every 10,000 newborns. Again, that just hammers home how truly uncommon this condition is.
So here it is, the official medical definition. A micropenis is an atypically small, but, and this part is super important, a normally structured penis. The diagnosis isn't just a guess. It's based on a very specific measurement, being at least 2.5 standard deviations below average, which is just a statistical way of saying it's significantly smaller than the norm for a person's specific age.
This table really helps put some real numbers to that definition. You can see right here, for a newborn, the average stretched length is about 1.4 inches. But the diagnosis of micropenis is only made if the length is less than 3/4 of an inch. And for an adult, while the average is around 5¼ inches, that clinical threshold is anything below 3.67 inches.
So that leads to the next logical questions. Why does this even happen? And how do doctors actually figure it out? Let's get into the science of it all.
Well, the main driver behind this condition is all about hormones. The most common cause, by far, is a shortage of testosterone while a male fetus is developing, specifically during that really crucial window in the second and third trimesters.
Think of it like this biological chain of events. It all starts with a signal from the brain. That signal tells the testicles, hey, time to make some testosterone. That testosterone then fuels the growth of the penis in the fetus. So if anything interrupts that hormonal cascade, development can be affected. Simple as that.
Now, while that testosterone issue is the main reason, it's not the only one. Other things can be at play, like specific genetic syndromes or a condition called androgen insensitivity, where the body actually makes testosterone but just can't use it properly. And sometimes, in pretty rare cases, doctors just don't know the exact cause.
The good news here is that the diagnostic process is actually really straightforward. We're not talking about some complex, invasive test. A doctor can make the diagnosis with a simple physical exam, almost always when a baby is an infant, just by carefully measuring that stretched penile length we mentioned earlier.
Okay, so once a diagnosis is actually made, what are the next steps? What are the pathways to managing the condition? Let's take a look at the treatments that are available.
There are really two main paths. The first line of defense, especially for infants, is testosterone therapy. This can be given as injections or even a topical gel, and it's basically a test to see if the penis can respond to that growth hormone. Surgery, which is called a phalloplasty, is a much more complex option. It's usually only considered if hormone therapy doesn't work, and it definitely comes with some pretty significant risks.
And when it comes to treatment, timing is absolutely everything. This chart makes it crystal clear. The response to testosterone therapy is way, way higher in infancy than it is in puberty or adulthood. This is exactly why getting that diagnosis and starting treatment early is so critical for having the best possible outcome.
Now, for the surgical route, the phalloplasty, the whole goal is to reconstruct and lengthen the penis. To do this, surgeons often have to use tissue grafts from other parts of the body, like the forearm. It's a major procedure, there's a high risk of complications, and the recovery can be long. It's a really serious step that requires a lot of careful thought. All right, let's pivot a bit. We've talked about the clinical side, but now let's get to the human reality. This is where we tackle the questions that really matter in day-to-day life. Function, sex, and what the overall outlook is for people with this condition.
This might be the single most important sentence in this entire explainer, so listen close. A micropenis is, by its very definition, structured normally. And what that means is that it can function normally. The size simply does not dictate the mechanics.
Just look at this list. The core biological functions are not affected. The ability to urinate, to get an erection, to masturbate, and to reach orgasm, they all remain totally intact. This is a huge point that often gets completely lost in all the anxiety around size.
So what about fertility? That's a big question, right? Well, it's true that some individuals might have a lower sperm count because of the underlying hormonal issue, but it is not a given. In many cases, fertility is not affected at all.
And this quote from a medical source just says it all. A fulfilling, intimate life is absolutely possible. The condition doesn't have to be some kind of barrier to experiencing sexual pleasure and having a real connection with a partner.
And this gets to a really harmful myth that our culture pushes all the time. This false idea that penis size equals masculinity. As this quote points out, that connection is just not real. People with this condition lead healthy, happy, and yes, sexually active lives.
Of course, the psychological weight of a diagnosis and all the societal pressure can be a heavy burden to carry. And that's exactly why professional support can be so incredibly valuable. Things like counseling and sex therapy are amazing tools for building confidence, working through anxiety, and just maintaining strong mental health.
So all of this brings us to one final, really big thought. We've established, clinically, that size does not determine function. So that kind of leads to a much bigger question for all of us, doesn't it? If we take this one physical trait out of the equation, how should we really be defining masculinity? That's something worth thinking about.